Breaking the wall of pulmonary obstruction. Blanca Costa Ávila. Falling Walls Lab, Bolivia.
How would you feel if you can breathe freely? Chronic obstructive pulmonary disease is a pathology that affects the bronchial wall by limiting airflow, damaging the bronchi, causing inflammation and reducing their diameter, causing an excessive production of mucus in the lungs, which causes a cough and loss of lung elasticity. According to the World Health Organization, 64 million people were diagnosed in 2019 around the world, being the third cause of death with 3.23 million deaths. More than 80% of cases were occurred in developing countries. With this disease and the COVID-19, the number has increased dramatically. The solution that I developed to this huge problem is a splint made of a type of polyurethane, a material widely used in surgical and clinical procedures. This splint is going to be implanted in the bronchial narrowing, and its function is to open the bronchial wall, so it will improve the respiratory function and thus avoid the complication of this disease. This splint has the following properties. It is flexible, so it won't damage the bronchial wall and will adapt to the bronchial movements. It is expandable, so it will adapt to the respiratory movements, and it won't move from the insertion site or break no matter how much effort the bronchus make. It's personalized, so it can be used in two different ways. The first one is to implant the splint inside the bronchial wall, and the second one is to remove a part that is severely damaged of the bronchus and implant the splint with a 5mm sheet in the splint, so it can function as a scaffold. And this splint it won't produce any adverse reaction within the human body, and it can be used with antibiotics and other medications. We can use as many splints as the patient requires, helping them breathing better, improving the quality of life, and the most important thing, giving the patient the capacity to do the things they can no longer do due to the disease. It is accessible to all people because it has a low cost. Thank you.